Dave, we really do appreciate you making the time to join us here on our broadcast today. And I guess to
Having me.
jumping right in, can you tell us a little bit about DentaQuest and how your organization approaches the dental industry?
Yeah, perfect. And so DentaQuest, we're a purpose-driven oral healthcare company and dedicated to improving the oral health of all. That's really our mission. And we manage dental and vision benefits for close to 30 million Americans. And then we also provide dental care. We have 80 dental clinics across 6 states. And our kind of approach to dental and vision is just we're big believers in preventative medicine. And on the dental side, we even call that preventistry. But the whole notion here is, right, if we want to improve the oral health of all, we can't wait until those issues present themselves. And so we have to use that preventative and maintenance medicine on the front end that deters kind of downstream unnecessary costs, unnecessary utilization, and just poorer health outcomes. And so that's really how we approach the dental industry. And then I'd be remiss if I didn't say our parent company and our foundation, we do a ton of grants and programs, and over the years have actually donated more than $200 million in those grants and programs. And again, the whole idea there is to how do we work with our communities and our clients and our members and our providers to achieve measurably healthier outcomes and therefore create kind of better oral health communities across the country.
Now, I imagine that your work was interrupted much like the dental industries earlier this year. The shutdown due to the COVID-19 pandemic hit pretty much every practice across the country. How were the DentaQuest member dentists and your practices themselves impacted at the start of this?
Yeah, I mean, COVID has touched every industry, right? But arguably, probably dental the hardest, or particularly hard at least. And even though states and regions vary in terms of what was mandated or required, the vast majority of our practices, both the ones that we own, but then our broader network of practices, were closed for the latter half of March and April, and remained open for emergency care, but really, for all intents and purposes, largely closed. And number one, that has a massive impact to just our members' oral health, right? If they're unable to receive that preventative care that I had mentioned earlier, it's going to lead to challenges down the road. But it also has such a significant impact to the dentist businesses. And when you think of a lot of these businesses they're small businesses, right? And so the cash flow challenges, the personnel challenges, and the operational challenges to kind of how do we make this work when our volume just drove off a cliff. And so we've really been working to understand that impact and how we can best support our providers during this pandemic and as we work to kind of return to normal operations. And that's really why we implemented the survey, and we'll get into those details shortly, but sent it out to 40,000, Medicaid dental providers to better understand the impact of COVID on our nation's kind of health safety net, especially as it relates to dentistry. And over 90%, and this should not be a surprise to anyone, but over 90% said that they reported seeing their volumes of patients drop dramatically during the pandemic. And I think an interesting thing that really hit us is 1 in 6, so close to 20%, surveyed had less than 15 days of cash on hand. And the impact there, right? If you're a 3-dentist office with maybe 10 additional staff with front, hygienists, dental assistants, et cetera, you're looking at, you can barely make, the next paycheck based on current operations. So the impact is huge, and it's really impacts some of these small dental practices quite a bit.
Mm-hmm. And now you touched on this survey that DentaQuest put out recently, and that's one of the things I did want to speak with you about, because you asked a lot of questions of, as you mentioned, Medicaid practices out there. And can you kind of go over, first of all, why DentaQuest decided to put this survey out there, and then highlight some of the big takeaways that you've gotten from the data?
Yeah, so the reason we wanted to bring this out is really when you think of the value chain for dentistry, the providers are such a critical piece case, right? They're the ones delivering the care. And we, on the benefit administration or insurance side, right, are obviously connecting the members and providers, but we really needed to hear from the front lines to understand the impact that COVID was having on our member dentists. And so, our goal it wasn't a preconceived notion to say we need to figure out X, Y, and Z. It was really we need to understand how COVID is impacting them and how we can best help. So it was important for us to kind of take the snapshot of where we are and where our dentists are today, and then where are we going, and to get into some of kind of the findings. That they honestly, you hear so much when you open it up, and we wanted to, right? You hear from challenges to get PPE, which we listen to, and we're figuring out solutions there. We how to reopen a practice, right? We heard that loud and clear. And from that, we've started webinars that have sold out, right? And I didn't know webinars could sell out, but they have. And the whole idea here is that we're trying to educate in terms of the best practices as so. The whole idea of the survey was really just for us to listen and to figure out how we could best support our providers across the community to make sure, and across the nation, honestly, but to make sure that they were in a position that they could continue to deliver on our mission, which is to better the oral health of all, and the providers play such a critical role in
Hmm. So, what sort of takeaways were you seeing now that you've got the survey back?
that. Yeah, so start first, right? Vast majority of providers expect to see long-term changes, and this is both in clinical and non-clinical functions. And that's probably evident to everyone. That it was important to realize that our industry kind of knows that this is long term and probably isn't just the COVID period of 10 weeks type changes. What was interesting too is there was a big chunk of providers that came back and said they have concerns with how do they the kind of the occupational hazards of their staff members, and how do they get ahead of that so that they are able to employ people and able to deliver care safely. And then it also got down to patient trust, right? How can, especially when everything that's out in the news, and right, everyone's reported this has hit dentistry really hard, right? They talk about the aerosols, they talk about the PPE. And so regaining that member trust is such a critical component, because without it, everyone's just going to wait until something goes wrong. So that was pretty interesting. And a couple just quick stats that I thought kind of really summed up the learnings is like this whole notion of what providers think they have to do, but then can they actually implement those? And so 2/3 of our providers said that they should, right, create a practice that reduces the spread of aerosols through the air. But only half of those said they were confident they'd be able to. So that was important, right? People see the problem, but only half can identify like, hey, this is how we're going to solve it. And then what was fascinating, 94% of providers needed more PPE. And really that number should be 100%, right?
Mhm.
But only 59% were confident in their ability to acquire enough. And so when you start to think of like those takeaways and those learnings, we're sitting there saying, okay, they know that there's a problem, the providers, and how can we best work so that we can put them in a position to deliver oral health care safely? Because everything is going to come back to, can you safely not administer, but can you safely deliver oral health? And do you have the right protocols, the right equipment? And that's where we really kind of said, okay, how can we now empower our providers and give them the right tools so that they can deliver dentistry in the safest manner possible? And that's really our biggest takeaway, is making sure that we can arm our providers with the right materials, with the right information, and with the right avenues to procure PPE or new practices, so that dentistry can be delivered safely and it can regain the provider trust, the non-clinical staff, and the members, so that we can kind of keep this preventative dentistry notion going.
Yeah. And, the term I hear a lot right now is that, dentistry is approaching its new normal, or has reached its new normal. And from what you just said, it sounds to me like dentists can see that new normal out there, but they can't necessarily see how to achieve it in their practices for their staff and their patients. Are there things that can be done to help get dentists over that hump so that, they can make the changes to go forward?
Yeah, the thing that we'll say quite a bit, this isn't a light switch solution, right? Or a light
Mhm.
switch pandemic. I don't think those exist. And so this is going to take some time. And I think it's similar to the results from the survey is the vast majority of providers know that these are long-term changes. And so no one's looking for that quick solution. I think we're in the process of what does, and that term new normal can be used a ton of different ways. But to your point, like that's what everyone's looking for. Like, what does dentistry look like now? And we're going to see a heightened focus on safety. We're going to see kind of a transition to really meet the members where they are comfortable being met for their dental needs. And that might be more teledentistry. That might be kind of more old school, just phone consults when necessary. It might be new kind of delivery and payment models, right? Where we can make sure that we're aligned from an incentives perspective with our clients and with our dentists so that they feel that they can deliver care in the most appropriate manner and not just when someone comes into the chair. We'll hear so frequently from dentists, and this is true on the medical side as well, that they're on this fee-for-service treadmill that they can't get off. And so I think part of what's happening in this kind of this new normal is how do we move away from that and just make sure that we're taking care of the members how they need to be taken care of and the most appropriately, and not just bringing them in due to the fee-for-service notion. And so that's where some of that value-based care comes from. And at DentaQuest, look, we're trying to accelerate those changes. We're trying to provide the right environment for our providers to be able to deliver care appropriately. And just right, there's no rationale to resist, right? Why not lead that so we can build to a more sustainable oral healthcare system?
Mhm. So you just mentioned teledentistry as one of the things that's coming up, and where do you see teledentistry fitting within the industry going forward, and how do you see it being useful to help with the mission of spreading oral health and improving the oral health across this country?
Yeah, so teledentistry, to your point, it's going to continue to grow, and we're going to continue to see more and more utilization. And look, you can only do so much in teledentistry. You can't perform a cleaning. You can't have a film. You can't do a root
Mhm.
canal. But it can be such a valuable tool to our providers to make sure that members are getting good information and getting directed to the right care. And historically, we've used it even telephone consults as ER diversion, right? So if a member can connect with a dentist and state their problem, very rarely is the ER going to be necessary, and they can get them set up in a more appropriate place of care. And from a DentaQuest perspective, we're working with a company called Mouthwatch to do a pilot in all of our clinics to roll out teledentistry. And then we are looking at how do we bring that to the rest of our provider network. So we do encourage the use of teledentistry today, where allowed by states. Some states do not allow it still, but I think we'll see that shift. And our goal is to kind of give them a platform, the providers, to use teledentistry for all their DentaQuest members, because it can be such a valuable tool that allows providers to get off of this kind of fee-for-service treadmill. And we'll use that term internally, but you've seen it on the primary care physicians, you've seen it on the dentists, but everything being fee-for-service driven, this tool enables them to actually meet the members where they are, doesn't require them to come into the office, and can frequently allow or allow for less inappropriate care that, getting people in just to say, hey, you need to go see a specialist. It can kind of skip some of those steps.
Hmm. In terms of just overall changes, as the position DentaQuest has in the industry, you have the ability to encourage certain behaviors by incentivizing things such as preventive care. Is this an
Yeah.
opportunity for payers such as yourselves to kind of help the industry evolve a little bit and move forward? And can with all of these changes happening, can preventive messaging get to dentists right now at a time in a way they might not in other times?
I think you're right on. And as we kind of get back to normal, right? And again, back to we'll see what the new normal looks like. But there is going to be this little bit of gap in preventative care because people weren't able to receive it for, 6 weeks, some states 10 weeks, some states still are trying to get back kind of into that preventative care notion. And a couple things that we're doing at DentaQuest to kind of move past that and create an environment where preventative care is at the forefront. Number one is our dental home program. And we have over 10 million members in our dental home program today. And what dental home does is it essentially just assigns members to high quality providers. And so looking at all the data we have, we can make sure we match. There's geography and there's all kinds of other pieces in the algorithm, but it's making sure that you get assigned a high quality provider that then feels a responsibility for your overall oral health. So that's number one that I think is critical. And then on the heels of that, what we've built is a value-based care program where it is utilizing that panel that we are assigning to those providers, and then no longer paying solely on utilization based or fee for service, but kind of splitting the compensation to our providers between a capitation that essentially just means, hey, it's your job to take care of this member and do as you seem fit or as you deem fit. That's number one. We still pay some fee for service, but it's greatly reduced. And then we're paying on quality. And so when you think of how that changes, and puts an emphasis on preventative care, is we're essentially saying to the providers is like that our incentives are now aligned for you to just deliver great oral healthcare outcomes, and are no longer aligned or misaligned by us purely paying you on the number of members you see and D codes you submit. So that's been a really big shift. We kind of talked how Tele-Dentistry sits over all of that as well, and VBC kind of allows for more appropriate use there. And then the last thing that I'll say is, especially when we work with our clients in our states, we realize that dental is not the majority of overall medical spend. But how can we integrate with the medical side from what we glean on the dental side to better, overall health, not just oral health, because there's such a close tie with oral health and, morbidities on the medical side. And so whether that be cardiovascular disease, high blood pressure, even on the behavioral health side, on depression, there's such a link between oral health and those comorbidities that if we can create better medical dental integration, obviously, number one, we're going to have much better outcomes for everyone from a health perspective. And then number two, we should derive savings. And we all know that our industry, right, when you look at how we compare across the world, we need to deliver those savings. And so using dental information to deliver some of that to our medical partners will be a key component as well.
Hmm. It sounds like there are a lot of lessons coming out of this, and I'm wondering if one other lesson is the importance of access to care. Do your members, were they seeing more severe situations as they reopened and patients who couldn't get in over those 6, 8, 10 weeks were coming back? And does that really showcase how important it is to have access to dental providers in order to be able to take advantage of preventive approaches?
You nailed it, right? I mean, during the pandemic and the heat of it, and hopefully, right, knock on wood, we're past it, but who knows? But we did see as people started opening up, it wasn't easy because you created this like 10-week kind of surge of people trying to get back in. And when we look at our data, and different states kind of are going to at different speeds, and I think we've all seen that. But when we look at our data, some of the states that opened up right away, they got back to their 2019 volume in the first couple of weeks. And so this notion of having this like pent up demand, it's real. But it's also important that we create an ecosystem that can handle that. Because if we're not able to handle that pent up demand and people aren't able to get their preventative care, we're just going to kick the can down the road, and those misses on the preventative and maintenance medicine become big issues. And that's what we're trying to avoid. So I think your comment on access is right on. We're constantly looking at our membership, ensuring that they have multiple kind of choices for dentists that can in fact see them. And then we're working with our provider network to say, hey, how can we handle as this pent-up demand returns to normal, so that we don't just skip preventative and maintenance dentistry and make that kind of elective. It's important for us that that is kind of the backbone. And so we play a role in that, making sure we have adequate networks, making sure that we're working with our networks on what solutions they can put into place. But then most importantly, just getting the members back in for that preventative care is really critical for our mission.
Mhm. Well, Dave, we really appreciate you taking the time to join us today. We really appreciate what you're doing out there to help promote preventive care for oral health patients across the United States. Thank you very much.
Thanks for having me. I appreciate it.